in Canada. And as Joel Ballard explains, Dr. Bonnie Henry says it is time to forge ahead.
Every day, Claudia visits the Crosstown Clinic in Vancouver's downtown east side, where she gets 3 shots of medical-grade heroin, part of BC's prescribed safe supply program.
I love it because it's been helping me keep clean from street drugs for it's over 2 years now.
The program has been under review by Provincial Health Officer Dr. Bonnie Henry, and today she threw her continued support behind it.
This program, this policy, in its intent, is an important part of the spectrum of medical care that we are providing and that we need to continue to provide for people who use drugs in this province.
But Dr. Henry and those who worked on the review admit it needs some changes.
I would summarize the reach of this policy by saying that it's limited.
Right now, it's estimated that 115,000 people live with opioid use disorder in BC. Yet the current program only reaches just over 4,300. That's less than 4%. But she says despite the small reach, it's had positive outcomes.
The evidence shows that this is promising, but there's not yet strong enough research to say that this is an evidence-based intervention.
The report found some of the key benefits included a drop in the rate of drug poisoning events, a decrease in ER visits, and a reduction in the reliance on the unregulated drug market. But there were risks too, namely diversion, where some of the drugs are making their way to people without prescriptions. CBC News spoke to a drug user who says it's all too common, mainly because the safe supply isn't strong enough.
Anytime anybody on methadone asks their doctor, please give me a safe supply, they're just selling it and they're going to buy fentanyl.
Despite some of the risks, Dr. Henry says it's time to expand.
The program as it is, the policy as it is right now, does not go far enough.
She has made many recommendations to the province, including broadening the availability and types of drugs that can be prescribed, like smokable fentanyl. Moving forward, some advocates say the ball is now in the province's court.
Unless the government makes very bold steps to implement these recommendations, we are going to stay in the same place as we have been for the last 8 years, and that 6, 7, 8 people a day will die.
For its part, the province says it's reviewing the report, adding that it's already implemented several recommendations. Joel Ballard, CBC News, Vancouver.